Hey guys, today's advanced training is on joint inflammation, causes, and natural support strategies. And so when we look at joint inflammation and pain, obviously they go hand in hand. And acute pain, like for example, when you get an injury or a trauma, it's normal to have pain. You have inflammation in the area. It's all part of the healing response. And having pain is all part of that process because pain tells the body, tells the brain, we need to reduce tension, reduce stress on this area. We should stay off of it, or, just basically we need to allow it to heal. The problem is when we have chronic pain. Chronic pain is pain beyond the expected period of healing and really doesn't serve a purpose. We want to be able to be very active and do all the things we want to do throughout the course of our life. And chronic pain and chronic joint inflammation can be major limiting factors in what we want to do throughout the course of our life. And chronic pain is a huge issue in our society today. They're one of the fastest, one of the most prescribed medications are opioids and different pain, different non-steroidal anti-inflammatory medications, steroids. These things to help reduce inflammation and pain are very commonly prescribed, and they have terrible side effects, and they never really get to the root cause of the issue. And that's what we're going to go through in this presentation here. And so we know inflammation affects every area of the body. And inflammation, again, is part of the body's natural healing response. Inflammation itself is not a bad thing. Inflammation is designed to protect us from dying quickly from some sort of systemic disease, systemic infection. Years ago, our ancestors, when they got an infection, the infection, which typically would come in from some sort of tissue trauma, so they would have a wound, the infection would get in, and very often the infection would spread and it would get into their lungs possibly and cause pneumonia, or it would get into their nervous system and cause meningitis. And people would die from systemic infections, might get into the heart and cause pericarditis. So they would die from systemic infections, from bacteria getting into, different tissue wounds and spreading throughout the body and destroying major vital organs. Today's day and age, we really don't die from infections. That's very rare in a first world country. But the body has hardwired itself to protect itself against some sort of infectious bacteria from damaging major regions of the body. And so the way that it's hardwired this adaptation is through inflammation. And inflammation is an immune response where the body starts upregulating all these different immune cells that damage things, and they certainly will target and damage bacteria and protect us from dying from the infection. The unfortunate thing is when they're up, when we have inflammation up for a period of time, it damages our vital organs as well. We've all experienced like a sprained ankle and we've had swelling and pain in that area. That's part of the inflammation process. It's damaging the tissue. It's actually breaking down tissue so that the tissue can be rebuilt. It's also protecting against the infection. The problem is when that inflammation never stops and when it's a low grade, kind of smoldering level of inflammation over time that damages different regions, right? And it affects every system of the body. And of course, today we're talking about joints. And the main things that we'll experience when we have chronic joint inflammation is joint degeneration, osteoarthritis, and then, of course, we will have pain, right? So we'll have pain in the joint. We'll have limited range of motion and mobility in the joint. And we'll obviously experience pain and discomfort and loss of, just our range of motion and our ability to really live the way that we want to live. So here's an example of a normal joint. Here's an example of an osteoarthritic joint, right? An inflamed and damaged joint. Now, this typically takes a minimum of 20 to 30 years of chronic joint inflammation. It's not like this happens overnight. It's usually a long process, 20, 30 years of chronic inflammation in the joint to get it to degenerate like this. Okay. So it's not even like a year or two, although, in certain cases, you can have like a car accident, whiplash, or, major trauma possibly to your knee. This is a knee joint, for example, that accelerates the inflammation over time. However, usually these are processes that take quite a few years, decades to develop. Now, some of the major things that contribute to joint inflammation, well, one is bad diet. According to a 2018 review published in Autoimmune Reviews, eating a conventional Western diet high in inflammatory processed foods can increase inflammation through increasing insulin resistance and obesity. So, insulin resistance means your body is not responding to insulin. Insulin drives up inflammation throughout our body, and particularly into our joints. A 2020 study published in Clinical Rheumatology showed that participants with autoimmune joint inflammation found that increased glycated hemoglobin, or hemoglobin A1C, which is one of the key labs that we look at when we're looking at inflammation. It's a long-term marker of blood sugar imbalances and other heart disease risk factors. So a high hemoglobin A1C means your blood sugar has been elevated for a long period of time. And that elevation creates glycation, where the sugar molecule binds to proteins and creates a change in the way that the protein reacts. And the protein now becomes highly reactive and damaging. It creates a lot of oxidative stress in the system, which can increase your risk of heart disease, joint inflammation, all those types of things. So basically, people with higher levels of hemoglobin A1C, meaning higher blood sugar levels, had more inflammation in their system and more symptomatic autoimmune joint inflammation. So very important that we get rid of, or minimize our exposure to bad food ingredients. That's so important. So insulin resistance is developed because, in a sense, we tend to eat a high carbohydrate diet in our society. So if you're eating cereal, oatmeal, things like that for breakfast, that is going to drive up your blood sugar. Now, those sugar molecules will glycate to proteins, and they'll create these advanced glycation end products, these AGEs that damage tissues. So the body knows that high sugar is toxic to the bloodstream. So it will release insulin. So if the pancreas releases insulin, insulin's job is to take the sugar to the cells where it can be used as an energy source. But what happens is when we have this chronic consumption, now our cells themselves become inflamed and damaged, and they do not respond to insulin effectively. So they become resistant to insulin. Now blood sugar stays elevated. We have to produce more and more insulin. And that more insulin activates inflammatory gene pathways, which promote more inflammation. Okay. And so now we've got more inflammatory molecules in our system. And that just increases the amount our carb cravings. It's kind of this constant carbs, make us feel good for a period of time. But inflammation's driving up blood sugar imbalances in our system, which causes more cravings. So then we constantly are eating more carbs, blood sugar goes up. We have this roller coaster that takes place. So when I'm looking at the labs, two major labs that we look at are your fasting insulin. And so what we want to do is we want to see what is your insulin, your blood insulin like after fasting for, let's say, 12 to 14 hours. And normally it should be between 1 and 5. A lot of times I'll see people where their levels are 12, 14, 16. This is a sign when you have insulin levels like that, even though you haven't eaten in a while, that your body is insulin resistant. It's not responding to insulin and it's overproducing insulin. Now, we're also looking at the hemoglobin A1C levels because that tells us how much of the red blood cells have been damaged by blood sugar, by sugar molecules binding to the proteins and creating functional changes and creating sticky proteins that are what we call glycate. Basically, they're glycated end products is what they're called. And so that optimal level should be between 4.5 to 5.2. Many experts want to see it under 5. If it's 5.7 to 6, that is considered pre-diabetic, and then up over 6% is diabetic. However, we never want to get, past 5.2. We want to keep it down around 5 or below, so we have less of this sort of oxidative damage to our blood cells. So very important numbers that we look at. Now, your gut is so important when it comes to your overall inflammatory load. We know that the gut is one cell wall, and it works like a cheesecloth, allowing only nutrients through, but keeping larger food particles and pathogenic bacteria, yeast, and parasites out. In a leaky gut, the tight junctions are loosened, so undigested food particles and pathogens can get through and activate the immune system, which causes inflammation and food sensitivities. So clearly, we want to make sure that the gut is strong and that it's very has good integrity, good resilience to stress. Both gut dysbiosis, which dysbiosis means bad bacterial balance. So we have all these bacteria and microorganisms, and many are good and some are not so good. And we need to have the right balance. Dysbiosis means an overgrowth of bad, not enough good. So gut dysbiosis and leaky gut syndrome increase inflammation throughout our body, including our joints. A 2019 study published in the journal Helion found a correlation between gut dysbiosis and joint inflammation. Again, gut dysbiosis leads to low-grade systemic, that smoldering inflammation that can increase the risk of symptoms of joint inflammation. So very important, again, that we're working on our microbiome and helping to heal and seal the gut. So important. Now, stress is also a huge factor. When we have increased amount of stress, we increase cortisol. Cortisol causes a loosening in the gut junction. So cortisol, high stress hormones in general, epinephrine, norepinephrine, will cause more gapping in the gut and cause more issues with inflammation coming from our gut. On top of that, it causes blood sugar imbalances. So when we're under stress, we're turning up blood sugar imbalances, as well as we're also turning up leaky gut. So it's really important that we keep stress under control. I think all of us realize that stress is a major culprit when it comes to increasing inflammation and detrimentally affecting our life and our health. So very key. Now, biotoxins. Biotoxins are hazardous organic substances that can cause significant damage to the human body. These compounds are produced by living organisms, and biotoxin illness happens when these biotoxins affect the body adversely. So we're looking at things like mold and yeast. So mold exposure from the air, for example, Lyme disease, different viral infections like Epstein-Barr, bacterial endotoxins like something called LPS, lipopolysaccharides, which is a bacterial waste product that's released from the gut that can get into the bloodstream and trigger inflammation. So these are all things that drive up inflammation in the body. Now, we look at chronic infections. Lyme disease and Epstein-Barr can increase chronic inflammation and trigger joint inflammation, joint pain, and other musculoskeletal problems. A 1995 review published in the American Journal of Medicine found that joint, tendon, and muscle pain are common characteristics of Lyme disease. And we have a serious issue of chronic Lyme disease. Now, normally we should be able to deal with the Lyme spirochetes. And however, unfortunately, many people in our society, due to a compromised immune system, have a massive overgrowth of these spirochetes that they typically encounter from a tick bite or possibly a mosquito bite at some stage in their life that becomes reactivated oftentimes and drives up more inflammation in the body. A 2011 study published in the Journal of American Academy of Orthopedic Surgery found that joint inflammation is a common orthopedic complication of chronic Lyme disease. A 2016 case report published in Rheumatology Clinical found that, excuse me, Epstein-Barr virus can lead to inflammatory patterns and joint inflammation. So these are definitely important considerations that we've got to look at. We also have to deal with mycotoxins. Mycotoxins are toxins that are produced by molds. And these compounds are known as biotoxins as well, and they're poisonous substances produced by living organisms. And so mycotoxins are kind of the way that mold has plant warfare, right? So it's competing with bacteria, it's competing with other living organisms, and it releases mycotoxins as part of its chemical warfare process. Unfortunately, these mycotoxins, if we're exposed, they're going to drive up inflammation in our body as well. A 2003 study published in Clinical Rheumatology found that mold from moisture damage can trigger an autoimmune response and result in related joint symptoms and joint inflammation. So mold and mycotoxin exposure are definitely big issues that we've got to make sure that we're reducing our overall exposure to. And I'm going to go through some solutions too as we go on. Now, before we do that though, I'm covering all, some of the major causes, I should say. I'm, not necessarily all of them. There are things like, for example, oral infections, cavitations, and different issues going on in our mouth, right? So many people are dealing with cavitations in their mouth, which are areas that have been like where we've had teeth pulled that are harboring bacteria. They have root canals that are harboring bacteria, just basically depleting the immune system, driving up inflammation. Some people have gingivitis or different levels of inflammation directly in their gums and their teeth that will also drive up inflammation. So that's a major factor as well. Now, vitamin D is definitely critical when it comes to joint pain and just chronic pain in general. Vitamin D is incredibly important for your joints, muscles, and bones. A vitamin D deficiency can not only weaken your bones, that can lead to joint issues, but it also affects your immune system, increases inflammation, triggers autoimmunity. Of course, that increases your risk of joint inflammation. 2017 study published in the Orthopedic Journal of Sports Medicine found that low vitamin D levels have been associated with cartilage problems and joint inflammation. A 2015 study found that taking vitamin D may help to prevent articular cartilage erosion and joint inflammation. So very important that we address vitamin D levels, and ideally getting our levels up over 50 nanograms per milliliter is going to be optimal for us. Now, omega-3s, according to a 2018 study published in the Clinical Journal of Pain, high omega-6-to-3 ratios have been associated with inflammation in the knee joints. On the other hand, according to a 2018 study published in Open Heart, a low omega-6-to-3 ratio, so that is what we're actually trying to get. We need a omega-6-to-3 ratio roughly around 2-to-1, 2 parts omega-6, 1 part omega-3. Most people are walking around with like a ratio of like 20-to-1, way more omega-6 than omega-3. You can see on this slide that excess omega-6 and insufficient omega-3 consumption can lead to that dietary imbalance and drive up inflammation. So this 2018 study published in Open Heart showed that a low omega-6-to-3 ratio can help to reduce inflammation. So again, we know that omega-3s are anti-inflammatory and they play a key role in every cell. This is a cell membrane. It's the outer wall of every cell in the body. And it needs to have the right amount of omega-6, the right amount of omega-3. It also needs saturated fat and cholesterol in there. So we need the right ratios of these fats. Unfortunately, most people, because they're eating a lot of corn oils, soybean oil, a lot of processed foods, lots of grains, and then they're also eating a lot of grain-fed meat that's been fed a lot of grains. All those things are very high in omega-6, low in omega-3. So we want to increase our omega-3s in our diet. So important. And so the best foods for that are going to be our grass-fed, organic, pasture-raised animal products. So those are going to be very high in omega-3s. Also our wild-caught fish and seafood. So wild-caught salmon, extremely high in long-chain omega-3s, are going to reduce inflammation in the body. We also want to make sure we're consuming things like lemons and limes. We're low glycemic fruit that's not high in sugar, but also very rich in antioxidants, vitamin C, bioflavonoids. So very good there. Berries, avocados and avocado oil, green tea, which has epigalactin catechins, which are very good polyphenols for reducing inflammation. Non-starchy vegetables, so your broccoli, your cauliflower, your cabbage, your kale. So these kinds of things, again, are going to reduce inflammation in the system. They're not driving up blood sugar. They're not starchy. They're very nutrient dense. Bone broth, vegetable broth. Broth is one of the best things, particularly bone broth and getting more collagen in our system. Really good for joints, right? Provides a tremendous amount of key nutrients like hyaluronic acid, glucosamine, and chondroitin that help support joint health. So bone broth, vegetable broth, very important. Apple cider vinegar, so key for reducing inflammation in the body. Very good for stimulating bile flow, stomach acid production, digestive juice production. So we love apple cider vinegar, ginger. So chewing on some ginger root before meals, drinking ginger tea, very good strategies for keeping inflammation down and improving digestive health. Ginger is also well studied for reducing inflammation in the body, and I recommend it as a supplement as well for reducing joint inflammation, but certainly getting it in our diet. Organic extra virgin olive oil and eating olives themselves. Olive oil is so powerful, lots of polyphenols in there, vitamin E, so very good healthy fat that downregulates inflammation in the body. Fermented vegetables. So some people, if you have a histamine issue, you may need to avoid the fermented vegetables, but for many individuals, they do quite well adding in some sauerkraut or some pickles or some kimchi or some coconut milk kefir or something like that. Really, really good for adding more probiotics, prebiotics, and postbiotics, more organic acids that are produced by the healthy bacteria that are in these foods, which downregulate inflammation in the body. Some of our sulfur compounds, garlic, onion, chives, can also be really effective for driving down inflammation. Using a lot of different aromatic herbs, basil, oregano, thyme, rosemary, sage, these aromatic, that meaning that they smell good, they taste good, these Italian style herbs, putting those on food. This is something that's missing in our society today. Most people are eating food without a lot of herbs. And so when we consume food, when we make, healthy meat, vegetables, things like that, it's so important to put on a lot of these healthy herbs. They're going to drive up the overall antioxidant levels. They're also carminatives, and they help with digestive juice production. So they help you produce the right amount of digestive juices, and they're antimicrobial. So they help to regulate your microbiome. Coconut products. So getting coconut milk, coconut flakes, butter, oil, really good healthy fats with medium chain triglycerides there that help your body burn fat for fuel, help keep you satiated. They turn into ketones in the brain. So a lot of great benefits there. So these should be kind of the staples in our diet that create the foundation of what we're looking for. Now, ketosis. So actually getting ketones elevated from time to time can be extraordinarily helpful. And we can do that through a low carb diet. We can also do it with intermittent fasting or a combination of a lower carb diet and intermittent fasting. And ketones are like a very clean fuel source. So they're like equivalent to a car that gets better performance. So they produce more energy. They have better gas mileage. They have less metabolic waste that's produced. So significantly less exhaust and carbon emissions. They're a really ideal fuel source for our body. And according to a 2020 study published in Pain Medicine, eating a low carbohydrate diet, such as a ketogenic diet, can reduce pain in people with knee joint inflammation. So ketosis offers similar health benefits as intermittent fasting. It helps increase cellular autophagy, reduces inflammation, improves your blood sugar, and reduces your risk of chronic disease. So fasting as well. I'm a huge advocate of this. And in this presentation, I'm going to go through a fasting pain protocol for you. But fasting drives up autophagy, where our body breaks down older, damaged cellular organelles and starts to replace them and rebuild them with new, healthier organelles. It shuts down inflammation in the body. It improves the microbiome, so the actual overall diversity of the microbiome and the types of bacteria. In fact, we know that that intermittent fasting actually increases one of the keystone bacteria called Akkermansia muciniphila, which is associated with lower levels of inflammation and better overall digestive health. And then fasting also helps regenerate immune cells. Many people have senescent immune cells, meaning immune cells that are too old. They're old. And because of that, they're driving up inflammation in the system. And so fasting helps to regulate that and regenerate new, healthier immune cells. Now, also very important that we're keeping stress down and that we're also prioritizing a good sleep. Now, to get good sleep, I prefer to have my room cool, or you can there's different devices that help to make your bed cooler itself, right? So you can look at different things like that. Chili Pad is one of those. but I like to have an overhead fan on, sometimes the AC on. I like my room to be around 65 degrees with the fan on. I sleep better that way. Keep the room as dark as possible. Use a sleep mask, a little mask over your eyes to help block out light so you can produce more melatonin. Melatonin is a really powerful anti-inflammatory hormone that your body naturally produces that regulates your inflammatory levels. Avoid caffeine within 8 hours of sleeping. So you don't want caffeine too late in the day. It can affect your sleep quality. Don't eat within 3 hours of sleeping. So try to finish your last meal by 7 p.m. ideally, and try to get as much sleep before midnight as possible, at least 1 hour before midnight. They say every hour of sleep before midnight is equivalent to 3 hours of the regenerative capacity of sleep after midnight. So doing your best to try to get to sleep at a good time is so key. Get sun exposure during the day. So get out during the day and try to get some exposure to sun. That actually will help set your circadian rhythms and help you sleep better at night. Exercise regularly. So exercise, but not late at night. So the latest you'll want to exercise is roughly around 4 or 5 o'clock. Okay. You don't want to exercise, at least not too intensely. After that, that can affect your sleep quality. Avoid bright light after sunset. So dim your lights in your house, for example. Put on blue light blocking glasses. That can be really helpful if you're looking at your devices, or if you're watching, a program on TV or something like that. That will help reduce the amount of blue light you're being exposed to. Blue light's going to drive up stress hormone, and that's going to reduce your melatonin and reduce your ability to get a good night's sleep. Wind down at 9 p.m. You shouldn't have goals after 9 p.m. You should be relaxing, winding down, getting ready for sleep. I ideally try to be in bed by 10. Again, every hour of sleep before midnight is equivalent to 3 hours of the regenerative capacity of sleep after midnight. So it can be really important. Now, movement and exercise. In general, movement and exercise are different. So exercise is something at a high intensity, really trying to get your heart rate up or build lean body tissue. So it's strength training or some sort of like a interval training. That would be an example of exercise. So it's going to be done at a higher intensity, whereas movement, just going out, taking a walk or riding a bike or something along those lines, that is low intensity, but we're getting movement in. And movement is key. Movement helps increase circulation, stimulate lymphatic drainage, enhances the oxygenation of your different tissues. It helps drive up the right types of neurotransmitters and balance your neurotransmitters. So you're calm, you're relaxed, as opposed to being agitated and irritable and anxious. It helps reduce stress and tension on the body, helps activate some endorphins, which make you feel good, improves your mood, your happiness level, and enhances mental clarity and memory. So we should be moving throughout the day. Now, if you have serious joint inflammation, you may not be able to do high intensity exercise. If you have serious joint inflammation in your knees, for example, osteoarthritis or something, then, using something that's low impact, maybe getting on an elliptical machine or a stationary bike will be more helpful for you to get exercise into your legs, as opposed to, running on a treadmill or running on concrete road or something. That's going to be high impact, put a lot of tension and stress on those areas and not allow you to heal properly. So, you're going to have to partition your exercise based around where your joint inflammation is, but all of us should be doing what we can to move, to get movement in. Movement itself is anti-inflammatory on the system. Exercise is designed to improve our cardiovascular output, as well as our lean body tissue. So building strength, endurance, that's the goal of exercise. Movement is all about improving circulation, tissue oxygenation, and enhancing the healing process, keeping inflammation under control. So getting out, getting movement in on a regular basis, just so important here. Now, we got to support the gut, right? We talked about that and how important the gut is. And so probiotics can be extremely important here, taking the right form of probiotics and taking enough probiotics. We may need to support our overall digestive health, right? Our stomach acid levels, our digestive enzymes. And so that way we're optimizing our digestion. That's going to help keep inflammation under control. We may need an air purifier. Air purifiers help to pull toxins out of the air, things like mycotoxins, for example, that we mentioned earlier. And so that way we're breathing less toxins. When we breathe toxins in, it drives up inflammation. Less toxins in our air, less inflammation we're going to drive up. So I recommend an air purifier. I have a link that you guys can check out. And by the way, any of the studies references, go ahead and check out the document that comes with this video. So be sure to check that out. We've got all the resources there. Now, the process of detoxification and eliminations, we want to make sure that we are eliminating toxins. So we got to make sure we're breathing well, because we eliminate a lot through the lungs. We also, so the liver is our primary detoxifying organ, but it's really deactivating toxins. It doesn't get stored. Toxins don't get stored in our liver. Toxins have an affinity for our fat cells, our bone marrow, our central nervous system, our brain, for example. And they can also affect our joints, our blood, our tissues, and our muscles. So the liver itself is deactivating the toxins, and then we're eliminating them through our skin, through our kidneys, through our colon, and through our lungs, right? So we're getting rid of them through those areas, and that's how we are getting them out of our system, right? So we got to make sure that those things are open. We're hydrating our body. We're peeing and pooping our way to good health, right? So important. Now, optimal vitamin D. Vitamin D deficiency, we already know and we talked about, can contribute to joint inflammation. According to a 2017 study published in the International Journal of Molecular Sciences, vitamin D plays an important role in reducing inflammation and pain management. And a 2015 study showed that vitamin D supplementation can reduce chronic pain, which is a common characteristic of joint inflammation. So obviously very important. We should be getting our vitamin D levels checked on a regular basis, really making sure they're up over 50 nanograms per milliliter, and ideally up, especially if we're dealing with chronic inflammation, getting them up around 70 to 80, maybe up to 100. Now, EPA and DHA, so these are the long chain omega-3 fats. So when we eat chia seeds or flaxseed, that is a small chain omega-3, ALA, alpha-linoleic acid. Alpha-linoleic acid is less so associated with reducing inflammation. It's the long chain omega-3s, EPA and DHA, that have a higher association. These are the ones that really drive down inflammation. And it's hard for our body to convert the small chain omega-3, ALA, that we find in plant foods to make it form into EPA and DHA. So this is why it's important that we're getting these long chain omega-3s from animal foods, particularly wild-caught fish, wild-caught seafood, grass-fed animal products, grass-fed beef, for example. And then, of course, very important that we're also supplementing with it if we already have joint inflammation. A good omega-3 to 6 ratio is critical for reducing joint inflammation. A 2007 meta-analysis. Meta-analysis that's a review of all the double-blind placebo-controlled studies. So it's, really the highest ranking, and it's looking at human studies. So this is published in Pain. It showed that 3 to 4 months of supplementation with omega-3 fatty acids can help reduce inflammatory joint pain. So ideally, trying to get around 2 grams of this EPA and DHA seems to be the sweet spot. A 2020 study published in the Mediterranean Journal of Rheumatology found that omega-3 fatty acids can benefit autoimmune joint inflammation. So we know that it's going to reduce inflammation, whether it's osteoarthritic inflammation or even autoimmune activity as well. Now, a supplement that I'm also really big on is proteoenzymes, proteolytic enzymes, really powerful for breaking down circulating inflammatory proteins and supporting, and so things like high sensitivity C-reactive protein, for example. Proteoenzymes helps to chew that up. So it chews up the inflammatory molecules. It also helps to break down damaged tissue, form new, healthier scar tissue, new, healthier joint tissue as well. So proteoenzymes is part of my advanced protocol for reducing inflammation. And I also like to use these herbs: turmeric, ginger, boswellia, and rosemary. So these are well studied. When we look at curcumin, which is the main ingredient in turmeric, It's been shown to help boost detoxification, support healthy heart function, promotes healthy mood balance, helps with fat burning and metabolism, supports joint and muscle health, fights whole body inflammation, supports healthy skin, and helps improve cognitive function. Curcumin, again, is the active ingredient. And a 2016 systemic review and meta-analysis of randomized clinical trials, turmeric extracts and curcumin may reduce the symptoms of joint inflammation. According to a 2016 review published in Drug Design, Development and Therapy, curcumin has anti-inflammatory benefits for joint inflammation. So very, very powerful, well-studied. We want to get adequate doses, though. In some cases, we need really high doses, right? At least like 1 gram multiple times a day to get the best benefits. So if you're not noticing that your body's improving, if you're taking low doses of curcumin, you may need to boost up your dosage. And that's oftentimes what I will do is high doses. A lot of these things synergize, like turmeric and ginger really have a good synergy. Ginger is an anti-inflammatory herb similar and from the same family as turmeric. According to a 2001 study published in Arthritis Rheumatology, ginger extract has shown positive benefits for knee joint inflammation. 2015 systemic review published in the Nutrition Journal has also found that ginger has anti-inflammatory benefits, and a 2013 comparative study published in the International Journal of Rheumatic Disease has found that ginger and turmeric used combined have anti-inflammatory benefits for joint inflammation. So they synergize, work really well together. So if you can find a supplement, obviously you can do this with your diet, but to get clinical dosages that are going to really, really move the needle quickly, using a supplement that combines these can be really powerful. And then you can even get a higher level of synergy when you combine it with boswellia, which is also called Indian frankincense. According to a 2019 randomized, double-blind, placebo-controlled pilot study published in Phytotherapy Research, boswellia extract can be beneficial in the management of joint inflammation. A 2020 systemic review and meta-analysis published in BMC, Complementary Medicine and Therapies, also found that boswellia can have anti-inflammatory benefits for joint pain. So when you take all three of these together, you're going to get a really great downregulation of your inflammatory pathways like nuclear factor kappa beta. It's going to inhibit these cyclooxygenase enzymes. These are all part of the inflammatory amplification process where inflammation just becomes amplified and hard to stop. And taking these three together, really powerful way to synergize and reduce those inflammatory proteins. So what I use is my Inflam Defense, which combines turmeric, ginger, boswellia, as well as proteolytic enzymes that are in there. And then also things like rosemary, quercetin, resveratrol, which are all really powerful for downregulating overall inflammation in the system. So my pain relief and supplement protocol, and this is on, oftentimes I'll have people do a 3 or 5 day or 7 day fast. It can be a water fast, or it could be like a bone broth fast, for example. And during this process, we'll take 10 proteoenzymes 2 times daily. We always take it away from any sort of food. So if we are doing a partial fast or, a bone broth fast or whatever it is, we want to take that away from meals. That way it can just get deep into the system and start to break down inflammatory proteins. If we take it with food, it acts like a digestive enzyme, starts breaking down the protein in our meal. So we want to take it away from that. And same with the Inflam Defense. So we're going to take 6 caps 2 times daily. So really therapeutic levels here. And we're doing this roughly for a week, okay, to get inflammation down quickly. That is the entire goal of here is, somebody has significant levels of joint inflammation. We are restricting the amount of food that we're consuming, getting into a low calorie state, which is naturally anti-inflammatory, elevates ketones in the system, which turn down inflammation. And then we're adding in these 2 supplements to dramatically reduce the inflammation in the body. And it's a powerful protocol that really works. I mean, if you want something that works quick, in a sense, a week is quick when we're dealing with some sort of chronic systemic inflammation. This will work. So, so definitely powerful stuff to try. You want to do it with either a partial fast, so like a bone broth fast, or a fasting mimicking diet where you're consuming roughly 800 calories or less for at least 3 days, ideally 5 days, okay, and maybe up to 7 days, doing that low calorie state, and that along with these supplements to get the best benefits. I mean, taking the supplements in that dosage itself, even if you're eating a normal calorie load, is going to work. It's going to reduce inflammation significantly, but you're going to get much faster, much more powerful, long lasting pain relief, utilizing this protocol along with the fast. So hopefully that's helpful, guys. Hopefully you guys enjoyed this training, and be sure to stay tuned for other trainings that we're doing in this inflammation series.